Let's look at some statistics on chronic pain. They're a little bit depressing, I'll warn you. If we look at low back pain, it is considered the #2 cause of sick leave. It used to be #1, but it's now been replaced by the umbrella condition called repetitive strain injury. And when I say umbrella, I mean a condition that includes many pain syndromes related to the neck and arm, and so it falls under the umbrella of repetitive strain injury. Getting back to low back pain has virtually an 85% incidence lifetime in most people. On a positive note, about 70% of us to as much as 90% of us will recover from the low back pain within 3 to 6 months from the first bout of low back pain. That's the good news. Unfortunately, within about a year, 40% of us will suffer a recurrence, and that was in the Bone and Joint Report in 2005. Many of us look at spinal surgery as the big solution for low back pain. Realistically, only 2 to 4% of people will be good candidates for spinal surgery, and the success can be variable. There's often a lot of failures, and we actually call that failed back surgery syndrome. So long-term results from low back pain can be acquired, but there are some failures that occur down the road. It is also important to know that low back surgery isn't necessarily applicable to everyone with low back pain, as I said, about 2 to 4%. And the reason is because many people with low back pain have what we call complicated low back pain, with several areas contributing to the problem and not a clear location where the surgeon can very clearly determine the cause of their pain. So most times people with low back pain have multiple levels and multiple problems eventually contributing to their low back and leg pain. Let's talk about other pain conditions and their incidence. About 80% of us will develop significant neck pain. 12 to 18% of us will suffer regular migraines, and as much as 4% of the population will have what we call chronic daily headache, not a pleasant syndrome. Repetitive strain injury, as I alluded to before, is this condition that applies to neck and arm pains that are typically related to repetitive activity, such as typing or washing cars or waxing cars. 80% of us in clerical workers often have symptoms, early signs and symptoms that is, of repetitive strain injury, with numbness in the arms or tingling or pain in the elbows or in the neck or shoulder. And this was found in an Australian National University report in 2003. So that the condition is very, very common and is fast becoming a very common cause of disability. In fact, #1 in many areas for sick leave. But if we add to these other numbers that I've already mentioned, the incidence of osteoarthritis, rheumatoid arthritis, and then we have the tendinitises like plantar fasciitis and other pain conditions in the arms and legs, and fibromyalgia syndrome, we start to see that the incidence of chronic pain is massive. In fact, we see incidences of chronic pain in the general population at somewhere between 1 in 3 to as much as 55%. This represents a significant part of our population, in fact more than half. As many as 5 out of 10 visits of the top 10 visits to going to a doctor are pain related. And think about it, how big could chronic pain be? Well, let's start looking at how all the advertisements and areas in medicine that we see where it penetrates. Look at the TV ads for all the anti-inflammatories and pain relievers and pain treatments that you see on TV. Consider all the professionals involved. We have physiotherapists, we have chiropractors, we have massage therapists, general doctors, we have orthopedic surgeons, rheumatologists, neurosurgeons, sports medicine doctors, physiatrists, and on and on and on. And it's because pain is very prevalent in our lives. We need to have a national strategy eventually invoked on chronic pain so that we can actually manage these conditions, prevent these conditions, early treat these conditions so the incidence isn't so high and we're not left with these high levels of pain requiring pain medication and other modalities which are expensive and often disabling.